All right, how you doing, class? Welcome to week 5. We're moving right along. We just have one more week left. So let's get it together and get everything going well. Stay focused. Continue to do what you're doing. All right. So this week we're going to talk about the respiratory system, the digestive or excretory system, and urinary systems. So we're going to start off first with the respiratory. So the respiratory system, there's two tracts. You have an upper respiratory tract and you have a lower respiratory tract. The upper respiratory tract is located inside the chest. Um, excuse me, located outside the chest, and then your lower respiratory tract is located inside the chest itself. Okay. The functions of the upper respiratory system and the structures, you have your nose and your nasal passages. They're responsible for the moist and warming the air itself as it comes in and goes out. The pharynx, which is your throat, it conducts the air to the lower structures. The larynx, or your voice box, vibrates the vocal cords and produces a sound. So you'll be able to hear when people talk. You hear myself. And then also you have the trachea, the windpipe. It conducts the air down into the right and left bronchi. So when the air is exhaled from the lower respiratory tract, it passes through the glottis, and then it goes through the vocal cords where that sound is. Then it goes into the epiglottis and then goes down into the bronchial tree. So when we talk about the lower respiratory system, you have these structures. You have the bronchi, the bronchioles, the ovii, the lungs, the pleura, and the pleural cavity. The bronchial tree consists of the bronchi, the bronchioles, and the ovii. The ovii are the terminal ends of the respiratory tract. That's typically where the gas exchange is done. Oxygen into the blood, as we talked earlier, oxygen in, carbon dioxide out. The function of the bronchial tree is to conduct the air from the bronchioles. The bronchioles are that smooth muscle. They're typically the diameter where the airflow flows through. And then you have the ovii. Those are they're the kind of great black structures. That's where the gas exchange is done. So the gas exchange, talking about that, O2 moves from the ovii into the pulmonary capillaries. We talked about that last week. And then CO2 moves from the pulmonary capillaries into the ovii. The main structure in your respiratory system is your lungs. Okay, lungs is they're a large, soft cone organ. It has an apex, which is on the top. The right lung has 3 lobes. Okay, superior, middle, and inferior. The left lung has 2 lobes. It has a superior and an inferior. The lungs occupy most of the space within our thoracic cavity. Next, we're going to talk about the digestive system. So the digestive system function is to ingest food, to digest it, and it's digested 2 ways, either mechanically or chemically, and I'll give you the differentiation between the two in a second. It also absorbs nutrients and it excretes waste. So difference between the two, so mechanical digestion involves the physical breaking down of the food itself into small parts, either chewing with your mouth or the mixing action that happens inside the stomach. The chemical breakdown is where you have glucose and all that stuff. The chemicals that are excreted start the breakdown to pull out those nutrients that you need inside the body itself. So the overview of the digestive system, just in general, you have the mouth, the pharynx, the esophagus, the stomach, small intestines, the large intestines, the rectum, and then you have some accessory structures that also assist. When we talk about that chemical breakdown, those accessory structures help with that. So those accessory structures are the liver, the gallbladder, and the pancreas. They all excrete some form of chemical or hormone into the body to break everything down, break the substances down to get all those nutrients that you need into the body. Additionally, with the digestive system, it also regulates the gastric emptying. It secretes the gastric juices, including that hydrochloric acid which goes in the stomach. That's that, again, that chemical breakdown. It secretes gastric hormones. Um, Digestion is typically limited to food, but they also absorb other structures. The main organ is your stomach. Again, so the stomach is there to be able to, once it goes down the esophagus into the stomach, then it starts to churn and grind and mash that food up into parts. That hydrochloric acid that's released inside the stomach helps that break down the process once it get into the next area, which would be our small intestines. The small intestines, their function is to digest and absorb. That's where all the nutrients and those things come in. And typically what's helping with that, you also have those digestive enzymes and the hormones that are secreted by the liver and the gallbladder dump into the small intestines in order to be able to start that breakdown. Then you go on to the large intestines. Okay, the function of the large intestines is to absorb any water or electrolytes that are inside the system. It sensitizes any vitamins, storage of waste, and then it also eliminates waste via feces or gas. Just to touch real quick on those accessory organs, the liver, the gallbladder, the pancreas. The liver has two lobes. Okay, they're located in the mid and upper area of the abdominal quadrant. The gallbladder is tucked right under the liver, and it attached to there's ducts, the common bile duct. That's where the gallbladder excretes those chemicals into the small intestines to start that breaking down. Then the main pancreatic duct empties right down into the common bile duct also, and it's also responsible, as they consider, an accessory organ for digestion. Last but not least, the urinary system. The urinary system is responsible for excretion of liquids. Okay, there's excretion can happen two ways. One, through the kidneys, one through sweat. There's also some excretion through the lungs, and there's also some through the intestines. So here's some of the organs of the urinary system. You got the kidneys, which you have two kidneys. Urethras, two. You have one gallbladder and one urethra. So the kidney, their function is to regulate the blood volume and electrolytes, regulate the acid-base balance, secrete any noxious wastes, regulate your blood pressure, believe it or not, and also regulate red blood cell production. The most important part of the kidney, that function that it does, is regulate the electrolyte and acid balance. And that's it. So quickly, just to cover, remember your assignment format. Make sure you submit your assignments on the worksheet that's provided. If it asks you to draw a rendition, you draw that rendition and then you can take a picture and submit it. That's the only way that assignments can be submitted. Everything has to be submitted within the worksheet that's being provided. Continue your discussion in your discussion boards. Make sure that you make your responses substantive and meaningful. And in order to be able to engage your classmates, make sure you ask an open-ended question. The open-ended question asks what, who, where, and why. The reason why this is important, we're all in the healthcare field, and it's very important for us to be able to get information from our patients. By asking closed-ended questions, you're only going to get a yes or no question, a yes or no answer, and that's not giving you the information you need. So I want you guys to get in the habit of asking those open-ended questions so you can receive more information. If anyone's having any problems, we have the tutoring sessions. I post the tutoring session schedule for the whole course. As the recordings come up, I will post them. You guys can review them at your leisure with no problem. Beware of the late policy that we have in place. Make sure you follow the guidelines. Everything is due on a certain day. The dates have not changed, so continue to follow those dates. Make yourself a calendar if you need to, in order to make sure you get your assignments in on time. Last but not least, my office hours are on Mondays from 5 to 6 p.m. I'm gonna take everybody in as needed basis. If I get you in, just sit in the waiting room, then I'll let you in once I finish with your classmate that's in front of you. All right, everyone have a great week. Great weekend. Continue. We just got one more week left. Stay focused and keep it moving. All right. Everyone take care. Goodbye.